Hi, hello, welcome. I had rhinoplasty surgery or a nose job the 11th of March 2020, so exactly 6 months ago, 2 days ago. I didn't hate my nose before surgery. In fact, I still wanted it to look like my nose. I just wanted to make a few small tweaks to make it look, in my opinion, better. Just to be clear, I'm not promoting rhinoplasty in this video. So plastic surgery is a very personal decision and one that you need to make for yourself. And any sort of surgery comes with risks associated with it. If you are thinking of having any sort of plastic surgery or cosmetic procedure, what I would recommend is to do your research so you are really well educated on the matter and can make your own informed decision. Why I thought I'd share my own rhinoplasty journey, if you like, is because when I was doing my own research into the topic, of course I was doing a lot of research based on facts and numbers, but I also thought it was valuable to hear from people's own personal circumstances and their own personal recount of what they went through with rhinoplasty or cosmetic surgery. And largely that was from YouTube, like this. So probably the number one thing you're wondering is, why did I get a nose job? And the why, I guess, is a number of factors. So I sort of became more and more aware of how my nose looked from different angles, and I started to shy away from photos taken of my side profile because I didn't like how that looked. And along with that, I became aware that the tip of my nose would sort of be pulled down when I smiled, so it would almost look like I had not a droopy nose but kind of a hooked nose. At first I considered filler because I've seen some really impressive before and afters of just putting a bit of filler above and below, like a dorsal hump like I used to have, and that can really even out the profile and sort of it can give the illusion of raising the tip as well. So I looked into that, but to be honest, I just didn't think it was the best option for me. So I think it would have cost between 600 or 800 minimum, and it was only going to last maybe like 6 months, anywhere from 3 months to a year, just depending on how fast my body breaks it down and also what type of filler I used as well. So I guess I just wasn't that keen on that option. And the thing with filler is it can only add to your body, so you can only technically make your nose bigger. You can round out the shape and do many changes to the shape, but it's always going to make it bigger. So that's when I began to think of permanent options like surgery, and I started to seriously consider it. Of course, with surgery, it's a lot of money up front, but then there wouldn't be any sort of maintenance. However, the thing is with surgery, it's pretty scary because it is a permanent change. Then if you don't like it, then you are stuck with it. So that's why it's really important to choose a good surgeon and make sure you're on the same page with them and really be confident in your surgeon and make sure their previous results are aligned with what you want to achieve as well. So I had a lot of time to consider it. I made myself save up for it so that I would also have that time to really consider whether this was something I wanted to go through with. So my objectives for surgery were 3 things. So firstly, to remove the dorsal hump or the bump that you couldn't see it from the front, but you could see it from the side. Secondly, to raise the tip. So raising the tip would also help stop the tip of the nose sort of drooping when I smile, or more so being pulled down. And the third objective was something called deprojection. So it's basically, you'll notice it on the side profile, and it's to make the nose not protrude so far out from your face. So my breathing was fine. Before surgery I didn't have a deviated septum or any sinus issues or any breathing issues like that. So obviously I wanted to maintain the level of functionality that I had. Reassuringly, my surgeon said that he or any good surgeon, when they do rhinoplasties that make your nose smaller and therefore make the air passages smaller, they do a lot of internal work to compensate so that you still have that that same level of functionality that you did beforehand, or even better functionality. So the details. So I had my surgery here in Melbourne, Australia, and my surgeon was Dr. Mark Baldwin, and the surgery itself was conducted in a small private hospital in Melbourne here. I had open rhinoplasty, which means they make a cut at the bottom of your nose and open that up and do all the internal work they need to do. It's quite fascinating. You can find full surgeries on YouTube as well of the actual surgery being done, but definitely don't watch it if you're squeamish. So recovery. So it was kind of a blur, to be honest. I mean, A, because I slept a lot, and B, just because I did take pain medication and that just made me really spacey. I didn't really have any pain. I guess the most painful thing, it's more so like a discomfort thing, but because you have all this packing, I couldn't breathe through my nose, so I had to breathe through my mouth, so that made my throat really dry and then sore. And also while eating, I didn't realize, but when you swallow, especially food, not so much liquids, but especially food, it creates a lot of pressure up in your sinuses. So because that was all blocked, then it created sort of this pressure pain when I was eating. So at the first week post-op appointment, I had the internal packing out, and it was such a relief. I mean, I could only, the nurse warned me, so because when the internal packing comes out, it no longer has that sort of thing pushing against it, so your nose can just swell, and it can stop you breathing. So I mean, I could still breathe a tiny bit, but like not well enough to be able to breathe through my nose full time. But I was really happy to get the internal packing out, because then I didn't have that pressure pain when I swallowed. And then at the 2-week post-op appointment, the external, so the cast and the tape all came off, so I had nothing left. And interestingly, once I had all the external stuff taken off, I guess that pressure was preventing me from breathing, but after that was taken off, I could actually breathe through my nose straight away. So I think I'll do like a little photo diary of my recovery. So now it's 6 months. You can see in the photo diary over time, the tip of my nose has really, like, the swelling has gone down, so it started really quite rounded, and that's like reduced down, and it's become more defined in its shape. So this is my nose now. You can barely see the scar. Of course I have makeup on, but even at like 1 week post-op, the scar was like light pink. I don't try to conceal it. You can't see it face on. You used to be able to see it from the side, sometimes like very slightly. It's nothing to worry about. I think if you have a good surgeon. It was just, the skin was like just so smooth, just so continuous and even, that I was so impressed. It was like it had never been cut there before, and it's not just a straight cut. They do this stepped cut. I think that helps with the alignment of the skin on both sides to really knit together. So a little biology lesson for you. So the nose is made up of a lot of cartilage, and the thing with cartilage is it takes ages to heal, so much longer than other tissues, and that's because cartilage, unlike the rest of your body's tissues, it doesn't receive nutrients so readily. So the rest of your body, it has a direct blood flow, but cartilage is avascular, where other tissues of your body have like same day delivery from like blood vessels, like a network of blood vessels. Cartilage has to rely on a diffusion of nutrients. So if you compare that to regular post and during a pandemic. So that's why surgeons or medical professionals say that it actually takes a full year to see the true result of a rhinoplasty surgery. And even if you wanted to have a revision surgery or whatnot, no good surgeon is going to touch your nose probably at least a year post-op. So I think this is a pretty good indication of what my nose is going to look like permanently. There'll probably be a few small refinements or changes in the next 6 months. I think the sort of number said to me was like 80%. I could be wrong, but yeah, so obviously this is like what it's gonna look like, I think. Was it worth it? Yes, I'm really happy with the result. I'm really happy I went through with it. Obviously it's a really scary decision, and a decision that shouldn't be taken lightly, to go through with plastic surgery, and there are risks. It's not just, you know, it's not just an easy decision to make, but I am glad I went through with it, and I had a really good experience. I had a pretty easy recovery. I can breathe the same. I have the same functionality of my nose, if not better. Yeah, I feel a lot less anxious about having photographs taken of me, or indeed filming. Sometimes the lighting can make it look crooked sometimes, depending on how it hits it. But I know that it's dead straight. Yeah, I'm just really grateful I got to do this, that I had the means to do this. And yeah, 100% recommend my surgeon. But having said that, if you're thinking of getting rhinoplasty or any sort of plastic surgery, definitely do your research. And yeah, I can't stress that enough. You need to do what's best for you, even if that is not going ahead with the surgery. Let me know if you have any other questions, leave them down in the comments. I deliberated sharing this because, I mean, I think even in this day and age, plastic surgery is still controversial, and on one hand there's a huge body positivity movement at the moment, but the statistics show that more and more people are getting plastic surgery or cosmetic surgery, and I guess I don't think the two are mutually exclusive, but I think there's still, you know, people want to get, or they do get plastic surgery, but they don't want anyone else to know. It's all this big hush-hush secret. But I think you can definitely still be positive about your body and want to change things. I mean, some things you can change, and then there's other things that you can't change. And then there's some things that you could change, but the surgery is too risky that you wouldn't. Okay, I think I'm gonna end this here. Thanks, bye.